Are you smoking cigarettes? Are you drinking alcohol? But also ask me, are you using any other substances or drugs that may not have been prescribed to you, things that you're getting over the counter? A lot of us may get supplements from Amazon and we don't even know what's in there.
And I like that about the reports for monitoring the future, and maybe many other studies, in which they also look into the reasons why the teens use. Like, to give you an example, as we know now, because of the results, the recent study results, the report points out that kids are vaping contrary to adults. They're not really vaping to kind of get off the other nicotine products, including cigarettes. They actually point out that they vaping because of boredom, but also because of stress and to relax.
If you see me typing away, I am taking notes because even though I'm here hosting, I'm still learning, right? So this is a learn. So I am taking notes. If they won't tell you, they might put it on paper. All right, everyone. Hello, and welcome to Transformed Minds, the podcast where we explore the real world intersection of mental health, addiction, and transformative care. I'm your host, Dr. Owusu. Don't many know me as Dr. O. You can call me that too. Each episode, we take a very thoughtful, practical, and evidence-informed look at how we can improve psychiatric and addiction care. From our clinical settings to community spaces. And today's episode is an Expert RX. And I'm so glad that you're tuning in with us today. And if you're new here, here's the vibe. With our host RX, it's just me and you, breaking down the research, sharing what actually matters for our work. With Expert RX, we bring in brilliant minds from the field, clinicians, researchers, physicians, change makers, anyone that is making a change in this field, we bring them here. And with Lived RX, that's where we have the real life stories come in. Guests who have lived it, survived it, experienced it, and are reshaping the system because of it. Today's episode, we have a very brilliant guest, amazing, and we are so excited to have her here, Dr. Sandra Gomez Luna. And please help me welcome the also amazing Dr. Luna. So, Dr. Luna, we're excited to have you here. Welcome. Dr. Luna is a triple board certified adult, child, adolescent, and addiction psychiatrist. She's also board certified by the American Board of Preventive Medicine and Addiction Medicine and by the American Society of Addiction Medicine. Dr. Gomez Luna is a distinguished fellow of the American Society of Addiction Medicine and a fellow of the American Psychiatric Association. Dr. Luna provides psychiatric evaluations, therapeutic, and psychopharmacological interventions to children, adolescents, and adults with psychiatric and co-occurring conditions. Dr. Luna completed her residency program in general psychiatry from New York Medical College at St. Vincent's Medical Center in New York, and she graduated from the Columbia University College of Physicians and Surgeons Child Adolescent Psychiatry Fellowship Program at St. Luke's Roosevelt Hospital in New York, where she served as the chief fellow. Dr. Gomez Luna also completed her addiction psychiatry fellowship at the Yale University School of Medicine. Dr. Luna is the recipient of the 2013-2015 Research in Addiction Medicine Scholarship Program at the Yale University and the American Academy of Addiction Psychiatry 2013-2014 Area 1 Regional Award. She is a member of the editorial board of the Carlett Report, Addiction Treatment, and a member of the newly formed Diversity, Equity, and Inclusion Committee at the American Academy of Addiction Psychiatry. Dr. Gomez Luna is an assistant clinical professor of psychiatry at Yale School of Medicine and an adjunct clinical professor of psychiatry at New York University. Please help me welcome the amazing Dr. Luna.
Thank you so much for having me here.
No, we're so excited to have you here. This brilliant mind is coming to share all her knowledge with us, her expertise with us. And today we're so excited to have you because despite the growing concerns about, youth mental health, the latest Monitoring the Future survey has reported a very historic decline in adolescent substance use. And it's this has like been holding steady over the past couple of years. And what does that mean for, prevention, clinical practice, and community service? So we're excited to have you join us and our audience to also come with us to find out how is this decline happen and what we can really emulate to keep this trend going. So to get started, we will talk a little, give our audience a little bit of a brief overview about the survey, and what the surprising trend we see is. And then we'll just have a few questions for Dr. Gomez Luna to talk to us a little bit about what she thinks about all of this. So, what I wanted to share with you all today is the problem that we've had over the past few years is that we see this co-occurring mental health and substance use disorders, and they're very common among adolescents. And historically, we've seen that substance use, like when you start very early on, is a very strong predictor for like future use of future substance use disorder diagnosis. And the care system often sometimes miss this early identification and coordinated intervention. The prevention methods have really faced some challenges, with the social pressure, when the digital age where there's so much influence from social media, and the children, adolescents, young adults, they have more access to new substances now that sometimes are like, what are you taking? And how is this even affecting your body? And when the pandemic came, we saw that there's been like a surprising drop in the youth substance use. So this survey that we're about to discuss is an NIH funded survey that looked at 8th graders to 12th graders. And it's a group of researchers at University of Michigan with Dr. Maish and Co. I apologize if I said your name wrong. Please call me to correct me. And this has been going on since about 2020. And the rates of alcohol use, nicotine, cannabis, we've seen that it's been like a drop recently, and this drop has remained stable since the pandemic. So the 2024 survey recently came out, and what it's showing is a historic decline among 10th graders, 12th graders, and 8th graders. Initially in 2010, it shows that in alcohol, there's been a decline to 41% from about 45.7%. And in 10th graders, alcohol use has declined from 30% to 26%. And when we look at nicotine vaping, there's been a decrease in 10th graders from 17% to about 15%. And then when we look at 8th graders and 12th graders, there's been like a stabilization of the amount that they're using these nicotine vapes. And a new trend that was measured in 2024 was the THC, that they started measuring how many of these adolescents were using THC, and they found about 2.9% was using the Delta 8, which is a specific variant of the THC that they're using. And in 10th graders, about 7.9% of them are using this as well. But we still see this stabilization or decline in that. So today we sort of want to go into where is this coming from, because we saw like an uptrend of this until about the pandemic, and now there's a downtrend. Is this something that we're doing, or is just a coincidence that this is happening? So let's ask Dr. Gomez Luna, who knows a little bit more than both me and you. So,
Yeah, yeah. So again, very, very happy to be here. And monitoring the future is very, very important epidemiological study, and it gives us information about, like you mentioned, eighth graders, 10th graders, 12th graders. Every 2 years, they get surveyed, and we get information about what they're using, the extent of what they're using, and the ways in which they're using, and we see the trends. Some of the trends come up, some have come down of the uses through the years. It's important to mention that the study also includes surveys of young adults and people over 19, up to I think the age of 30. where you could also peek in their use to have a little bit of information about the use. But the majority and what we're going to be talking about here is about high schoolers, and eighth graders and their use. And as you very well pointed out, the recent surveys have indicated, survey studies have indicated results that the use of the majority of the substances known to be used in high school, they continue to decline, except for a couple of substances here on there, which it's important to mention in this podcast. And the way in which we're explaining this, and we're going to talk a little bit about the substances and the effect of the pandemic, right? And so people, contrary to what was happening with adults and people over 18 during the pandemic, their use of alcohol got really, really high in other substances. With the teens and the eighth graders, early teens, it was the opposite, right? Once the pandemic hit and the social distancing rules came up, that's when we saw the contrast decline, the significant decline, and the use of alcohol, use of nicotine devices, other forms of tobacco use, and also other substances, including marijuana, and the use of medications like prescription pills, painkillers, all these other substances. We do see that there were, depending on the substances, the obtaining of these substances through the internet, but it is mostly outside home that they are experimenting with substances. And when the pandemic hit, these kind of modes of methods of getting in the substances and kind of giving the substances to each other stop with the the socialization rules changing. What we are actually seeing is that the kids that are started were like in the eighth grade or ninth grade when the pandemic hit. Those are the kids who have continued not using or being even abstinent. We see in the results of the study in the report that the rates of being abstinent of all substances, these are the kids who actually never have used any of these substances, actually are historically high. We talk about the historical laws of, the numbers and the prevalence of the substances used in adolescents, but the number of kids who never really experimented or started using during this period of time post pandemic has actually increased. And it has to do a lot with the exposure, right? But then, one of the things that we know, perhaps start working with the kids, is if the substance is exposed, if the early they're exposed, the more of a chance for these things to continue use to a point in which it's excessive, worrisome, or addictive to the addicting levels. And so here we go. When the students don't have access to the substances, and that was because of the pandemic hitting, they then don't they that potential for continued use had it was not there because of the lack of the access to it. Therefore the teens kind of went on to I guess perhaps deal with this in a different with the kinds of reasons why they use in a different way. But because they were less and less exposed, then that means that these kids are going or are still continuing to not use. And so we are kind of like in the early post-pandemic stages still. It's been 4 years since the pandemic in terms of the results of the survey. We're in 2025 and we don't know. We hope that because of that, what we call the effect, the cohort effect, which is being demonstrated through the years of the study, that we think that maybe this is good news and it will continue happening, and the kids will continue into their Some of them are in college now and graduated from high school, and they will continue not using as much. Or, things will revert a little bit, and then we'll start seeing some of those trends coming, upwards instead of downward. But nevertheless, we are seeing that these were the kids who didn't have access, and they have continued to these historic lows. It's important to note that not all substances, and even though in alcohol, for example, the overall has been a historical decline on the use, there have been some things that are being kind of now starting to trend a little bit, like the use of alcohol with caffeine beverages, for example, in eighth graders. So I would say, hey, let's take a look at these kids, how they're going to show on the next survey when they're going to be on 10th grade and 12th graders, and we'll see how that's going. You actually mentioned another very important trend that we're seeing, which is the delta 8, which is the THC 8, very very similar to THC 9. And what's important to remember here is that it's almost like appear out of nowhere, and kids are being using it a little bit more. Although you pointed really, really nicely that the number has declined from the last survey to the survey before that. It's still pretty high if you compare with other substances, right? So we're thinking that kids have more access, talking about access again, right? Because what's happening with Delta 8 is that it hasn't been yet regulated the way that marijuana is regulated, where that people at this age and they're in high school, right, not able to get access to, they can't get in and get marijuana in dispensaries, even in the number of states that made it legal, but also in terms of like it's not that easy to obtain. But with Delta 8, because it comes actually from hemp, it doesn't really follow those state and federal regulations, then it's sort of like now catching up, right, with one of the reasons why we all read this study and the results of this study, because then it alerts us that this is a substance that kids are going to, and that we're going to learn about the effects, the consequences, but we're also going to learn about access and how to then regulate this substance. But that's another thing that we are seeing trending. The other, I would say maybe substance, maybe not, that I'm going to mention that we're also seeing a little bit of increase or significant for us to keep an eye on. That has also to do with the effects of the pandemic, we're thinking, is actually the use of creatine and the use of androstenedione. Easy for me to say. It's a pro hormone of testosterone. And even though creatine is not a drug, is not a hormone, it's a supplement that a lot of us kids are using, in adults, that they starting to use during these times of pre-pandemic, post-pandemic, that they were not really, wasn't as popular to use before the pandemic. And contrary to what was happening with the partying scene, right? That kids were not partying, they were not socializing, and maybe not experimenting with these other typical drugs of youth. They were turning more into fitness. And so we seen perhaps this is makes sense, right? So kids who are more into fitness, they are now using these, products that will enhance either their strength, or they enhance their way in which they lift, weights, or doing these strengthening movements and activities. And that has actually kind of continued to be shown on the latest post-pandemic results. So again, we have here a couple of things to think about, right? The eighth graders starting to use alcohol a little bit more, especially caffeine, those combined alcohol products. The Delta 8 showing up actually, pretty interestingly, not as high in terms of prevalence or use during the last year as marijuana, but something that's showing up that perhaps kids are having access to. and the creatine and the other, products that are helping the teens to kind of be in the gym and utilizing the fitness, equipments and things like that.
Yeah. Well, that was such an amazing summary of everything and giving us some expert opinion and highlights of what this study is showing. So that's amazing. And you've already sort of hit some of the questions that we had for you when you talked about what stands out in the study for you with the delta 8, THC, the alcohol trends, especially in eighth graders. So these are very important points to, if you are a provider, a clinician, you're taking care of young adults, children. It's important to note, like when kids come in, at least, screen for some of these things, right? That's some of the importance of this surveys that are out there. So we know what are the new trends, what are the new substances they're using. We know there's a huge fitness, like Dr. Gomez mentioned, a huge fitness trend going on social media. Everyone is working out, and we encourage that. We love that everyone is taking their health more seriously, but we also have to be on the lookout for the substances that may be misused through this process. So it's important to not just ask, your children that are coming into your clinics, your hospitals, are you smoking cigarettes? Are you drinking alcohol? But also ask them, are you using any other substances or drugs that may not have been prescribed to you, things that you're getting over the counter? A lot of us may get supplements from Amazon and we don't even know what's in there. So sometimes you can just ask them to bring them in. And it's important. And I love that Dr. Gomez has highlighted all these things for us. And one of our other questions was about sustained, like the theories behind the sustained drop. And I agree with you. Like when I looked at the study and I was looking at it, I was like, it looks like the predisposing like risk and factor was sort of eliminated during that time of the pandemic where all the kids were home, they're surrounded by family, there's a little bit more supervision in the home environment where you can't go out, you can't hang out with your friends. So that influence there was a little bit less, even when, they had social media. It's hard for someone to, get you something through social media or like compared to if you were out in school, you were hanging out after school, like all these things. So I completely agree with you. All these pandemic related changes, the parental supervision, the reduced social exposure, all of that played a major role. And I think, like you said, we're in the early times and it's important to sort of look in the next 2 years, 4 years, when the next surveys are coming out, what are the trends that we're seeing? Is it going to be a sustained sort of stability of decline? Are we going to keep downtrending or is it going to be an uptrend? So the next question that we sort of have is, what do you think we can do as physicians, healthcare providers to sort of mitigate the predispositions that we've identified, right? We know the parental supervision was really important in this decline, the reduced social exposure. And as psychiatrists, we always encourage people to have this social network, go out, go for a walk, hang out with family and friends. How do we find a balance between that for our children and our young adults where they have that reduced social exposure that mitigate the risk, but they're still keeping their social network very robust?
Yes, that's a very, very important question. And we have actually a privileged position, right? That being healthcare providers, people who are perhaps, as influential for these students as adults. I'm thinking because obviously, their peers would thinking as very influential for them. But as adults, think about educators, think about pediatricians, primary care physicians, psychiatrists, especially as they come into our clinics and our site, that we have that privilege of actually working and educating the families and the kids. And one of the things that I worry a little bit about these results post pandemic is that maybe we are kind of turned down some of that energy that a lot of people have, like for example, during the mid 20s before 2020. that we were so worried about, say, kids having access to the opioids. They still have access to opioids, and now they could be actually in a form in which they don't even intending. But what I'm really trying to convey here is that the work is not done just because we've seen some of the results coming down, that we have to continue to be vigilant, like you said, in terms of screening for substances, for substance use, even if it is at an experimental level, because again, the early these kids start using and teenagers, and the more of a chance for it to become really, really a problematic situation. Now we see them on the third decade when they're in their 20s, with significant alcohol use issues or with marijuana addiction, especially with high THC products they're using these days, or what have you. But when we see them in our offices, we have the opportunity to actually intervene by educating people. And we do it in a way in which we are kind of like bringing the person into the conversation, as we call it, the motivational interviewing kind of approach, where we sort of kind of bring in to where they are in their levels, not judgmentally. And then we say, hey, do you are you interested in knowing more about the effects of these substances, or what can happen if you could use this or that? And I think that's our golden time and opportunity to really tell the people about what we learned so far about these substances and what can show up, especially on adolescents, where the brain development makes them much more susceptible to the results of these substances and the unintended consequences of the substances, and also all these other consequences, not only medical but also social consequences. So my first advice is, don't shy away from bringing this the conversation. They might be coming in for a physical, but this is part of the physical. The other thing that I would say, other than educating, is also finding out the reasons. And I like that about the reports for monitoring the future, and maybe other studies, many other studies, in which they also look into the reasons why the teens use. Like, for to give you an example, as we know, now, because of the results, the recent study, this study results, the report points out that kids are vaping contrary to adults. They're not really vaping to kind of get off the other nicotine products, including cigarettes. They actually point out that they vaping because of boredom, but also because of stress, stress and to relax. So I think when you are with a teen in your office, if you're primary care provider, if you're a pediatrician, you are, you're by looking at this, gives you kind of like a window to investigate a little bit more why they're stressed. Is this something that might even lead into a clinical anxiety? We hear, like you pointed out at the beginning of this conversation, that kids are we have in this crisis of mental health, and so when you do that and you ask them the reason, then you could then an opportunity to either screen them for depression or anxiety or other conditions, and then refer them to treatment or investigate with the family a little bit more, maybe call them back to another type of visit, to then get to the matter, because we know that substance use, it's very, very expected that teens are going to use because there are other mental health issues or concerns. And if you're not, as perhaps yourself knowledgeable about it, then make sure that you refer to the person that's going to be able to investigate a little bit more. So again, ask the questions, don't shy, to ask, be respectful, not judgmental, educate, and ask the why. The why is very important, not just asking about how you're using alcohol, yes or no, or how are you vaping, yes or no. Why? And and that could open, I think, the opportunity for all of us to then investigate. And that is something that sometimes can get worse, right? Depression, anxiety, if we're not really quite intervening at the time, and for the family to be educated.
That is so important. Thank you. Thank you for all of that. Because I am a very advocate for educate, educate. I'm always like, you have to educate. You have to know the why. The why is important. There's always a why behind every story that walks into our clinics, our hospitals, any setting that you're working in. And sometimes when you miss the why, like you said, you miss the whole point. You miss the core value of treatment. And for a lot of our children, it may be different reasons why they're using. They may be an underlying issue that, if resolved, that can really significantly save them from the future stress, the future consequences that can come with it. And like you brilliantly mentioned, when we have that early detection, we can greatly sort of mitigate what happens in the future in their lives, because they're in a time of their lives where their brain is developing. It's susceptible to a lot of different things, a lot of changes, a lot of influences, and we want to protect them during this time of their lives. And you mentioned a few things. So if you see me typing away, I am taking notes, because even though I'm here hosting, I'm still learning, right? So this is a learn. So I am taking notes. And sometimes knowing the why is very important, and knowing that a lot of people are vaping because of boredom, right? Then we can start to sort of think about different programs. What can we do that they're not bored, they're not spending too much time on social media? What are the stressors, and how can we help them with these stressors? So that's very important. So thanks for highlighting that. You also mentioned screening and making sure, like, you're not just asking the questions, following up with the whys. I'm curious to know, um, do you think our current screening tools are very well equipped, effective, and able to sort of identify the trends that we're seeing? How quickly do you think it's able to do that for us?
Is a very, very important question. We see it actually in this study, monitoring the future, where they have had through the years adjust to the questions in the questionnaires, either naming different substances. Like, for example, the Delta 8 actually started in 2023. They officially included it. They also dropped some questions recently, because the evolving nature of all of these. So I would say that equals a little bit with the screening tools that we're using for adolescents. I actually love screening tools. I think that they are actually a way in which we could, again, get those answers. I always say, if they won't tell you the answers, they might put them in paper, right, or electronically. I think I love that opportunity. I think with everything that has to do with adolescence, it's not that there's so many opportunities to use validate the tools. Some of them are extrapolated from adults, but we are starting to understand that's not really the greatest thing to do, because kids and adults are very different type of, it's a very different, situations. So I think that there's still a lot of growth to do in terms of validating, finding those tools, but also modifying those tools so that then we can then kind of identify more of these, kind of situations, and have those conversations, follow-up conversations. So my answer, basically, you're seeing it on all these that I'm telling you, is that, yeah, they might not be the most, I guess, known, and there's not that many out there as compared to adults, and we are definitely starting to use them more, and there's opportunity to keep evolving those tools and validating them so that people then, in primary care settings and psychiatric settings and any other medical settings, in schools, for example, is starting to use some of these also to identify depression, anxiety, those kinds of screening tools are important, and we're having, like anything that has to do with substance use, or even mental health in adolescents, we haven't gotten 100%, to perfection yet. So yeah, let's use them. Let's use the ones we're validating. Let's evolve them and validate those. But then let's keep them in our a toolbox to use.
Perfect. That's amazing advice. From what I'm hearing, we have to adjust to the times and the trends. So if something is changing, we have to make sure we're modifying our screen and tools to capture what the times are showing. And that's very important. And it sounds like we've been able to so far do that as the times are changing, just as this monitoring the future study and survey is showing us right now. Do you think there are any like preventive or clinical strategies that we may have to rethink or maybe reinforce?
So I would say better than, I think maybe the better answer of that is, I guess we could adjust it more to using with adolescents, because there's always, the extra challenge of, for example, establishing rapport, right, with adolescents. And so these kinds of interventions, these kinds of preventative, interventions, we're always trying to kind of like get to them, perhaps using peers or people who are kind of like a little bit more like able to relate to them, maybe people who have been, I guess, through the these stories of substance use and then could come back and try to work and prevent. I would say still a work with progress in progress. Yes, we still need, I think a lot to growth in terms of preventing and, access to prevention interventions. Um, and at the same time, I think that we need to think about the how do we get that to these interventions to the population that we need, which is the young adolescents and children. So I don't want to say no. I don't want to say that, oh, we know how to prevent it. I think it's evolving still. But what I do want everybody to remember is that, getting the message to adolescents, it's a little bit tricky if you're doing it personally. I think we have been maybe a little bit more successful in terms of these campaigns, right, that you're hearing from on there. The one that people relate the most will be perhaps the tobacco campaign, right? Once we started to notice this is not good news, let's counteract some of the message that's being targeted specifically to to youth and young adults and adolescents and children, and directly address that to them so that they know, look, these products are looking like candy for a purpose, right? And this flavor is this for a purpose. I think that that general sense of messaging and preventative strategies are being successful. But I'm thinking about the one-to-ones, like the kind of interventions. So how do we help a person who has had perhaps some social, anxiety or some, issues socializing, to come out of the group of people who are using substances to, I guess, to deal with the kinds of things that would show up with struggles with mental health, and then introduce them to a group of people who are a little bit more, I think maybe perhaps a little bit more conscientious and mindful of the dangers of substance use. You know, uh, how do we do that when the trust in us, right, from that adolescent is not as easy to establish, right? Families, parents, they have that challenge pretty much every day, right? Because they're dealing with adolescents. So I think in that perspective, we definitely need to adapt more and improve more so that then those interventions get to them, to the adolescents who need it the most.
Yeah. Targeted treatment is very important, right? So we have all these treatment that's out there, but I love what you're saying. That one for one, right? That person that has been struggling with, you know, mingling with people, social interactions, how and now has found a group of friends that have accepted him, but that's where the influence of substance use is coming from. How do we help those kind of people, right? Those are very personalized and targeted treatments that can help as well. And the other thing that you mentioned that is very effective, I have seen it, I see it in some of the studies that I review as well, are those campaigns, because we're in a social media age, and unfortunately, a lot of kids do what their peers are doing. So when you get those peers to get involved in these campaigns, and there's a lot of trends like the TikTok trends, Instagram reels. So when all of these things are trending, and as we all love to say, goes viral, that's how we're able to influence, just as they're being influenced by all these negative statistics and packaging and commercial advertisement of all these substances. We can also use that same techniques and strategies to try to educate. So those are amazing strategies that you've given us, and hope that anyone listening, if you're a researcher, clinician, a trainee, that you are taking notes just as I'm taking notes, and you're going to be implementing these in your setting. With all the social media trends in the digital age, do you think there are any new behaviors or substances that may be replacing, some of these substances that we're seeing? Because just as the study showed, we see some things drop off, some things pop up. So what do you think is like some of the new trends, or do you think there are any new trends that are replacing others?
Yeah, I mean, we started seeing a little bit with, with alcohol a little bit, right? There are different products that are being used, flavorful alcohol, alcohol with caffeine, alcohol with high content of sugar, which is also pretty attractive to students. So we do see that, we're seeing, the kinds of maybe things are a little bit maybe, more subtle, like for example, kids who are again, like you said, with the fitness and building up and they see in the posting in social media, and they're sort of being motivated by kind of keeping up with the trends and uh, what's considered something that's attracting to them and reinforcing to them. I think that one of the elephant in the room that I'm sure you're very, very interested in talking a little bit about is the same, kind of vehicle for the kinds of things in social media, right? Which is the screens, right? And the social media themselves, so are we substituting, the actual physical substances for the, I guess, the addiction for screens or the overuse of screens? And since we're talking about, results of the pandemic, right, and post-pandemic trends, one that could not be ignored is that when kids stop socializing because of the social distancing rules, they started spending more time in these devices, and they also spend time in doing school, doing virtual school, and it became a little bit more, I guess, accepted because it's like it was a tool that people were using more and more during the pandemic, and that has continued, right? So are we then substituting the physical substances for the behavioral, if you might call it behavioral addictions, right? And so that is actually a very kind of like emerging still field in the field of addiction that is of most interest for us, adolescent, providers, because we see it every day and we not necessarily are as equipped to have that conversation like we called, before. And I say to myself, right, when I'm in the office with a teen and adolescent, I don't know what questions necessarily ask. Do I learn the lingo and then I talk to them about it, or do I go directly and ask them how many hours? Which some pediatricians, some people like me are asking, or do we ignore it? I think it's the time for us to also become familiar with this, and it's actually a concern of many people right now in our current society. Are we then passing now from these, substances abuse to now these behaviors of excess, and then that's I think the next chapter for us to, even this chapter, but the evolution into the next chapter for us to be really, really mindful that this is happening. And so we'll see.
Yeah, I think that's the best response, is that we will see, and hopefully, we are well equipped to sort of manage, or as it's happening, we're learning how to manage. when that behavioral is being substituted for the physical substances, the digital substances is replacing all these physical substances. How? So it's, how do you think we as community providers or community health stakeholders, schools, churches, how can we respond to this ongoing trend?
Yeah. So the first thing that I think we could, I can advocate more is for studies. So if you think about this, how important has been a study like Monitoring the Future, we're talking today, for us to understand the very, the more meaningful aspects of substance use at an adolescent age, which is stars everything, right? In terms of, the development into a substance addiction. So the same efforts, I think, needs to be put into research, into going into the high schools, or maybe even the kids who are not in high school, and then looking, into that data, and really going in deep into what's causing, their need to go in, because we have a lot of theories, but without the real knowledge, we're not going to be able to do the, kind of have more of the lawmakers, to do those kinds of things that they need to do, or the schools to be able to then, educate, or the professionals to be able to intervene. So we need knowledge, and the more we put efforts into this, the more we'll get the information that we need to then sort of attack, the issues if we have in them, as they're happening. I think it's important for everybody to sort of volunteer. I'm thinking about, this drug studies, some of the, companies volunteer their products to be tested. Why don't we, the social media, I guess platforms, kind of volunteer their products to be, analyzed by independent, sources, and through, investigators who are, non-biased, and that will be able to give us that information, just like we have made progress with other research.
No, that's I mean, I can't even think of not advocating for research, advocating for, funds to continue these research, advocating for, like you said, that's an amazing idea for these social media platforms to also, volunteer for their platforms, the services that they're providing, all of that to be independently analyzed and see how it's actually affecting, our youth, how it's affecting our young adults, and maybe work with the healthcare professionals to figure out how can we sort of mitigate some of the findings that may come out of that. And I think that's probably why a lot of currently there's a trend of a lot of professionals on social media, because we see the importance of social media, we see the importance of the digital age, and sometimes there can be a lot of misinformation. So we're trying our best to sort of combat all the myth that may be there, the misconceptions, and put out also some very evidence-based information out there for everyone. But we have learned so much over the last couple of questions. And I think one of the most important things I picked up, if you didn't, is if they won't tell you, they might put it on paper. That was such a powerful quote that I'm like, it stuck with me, because I'm like, that's true. A child may not feel comfortable telling you, but they may put it on paper. So currently, we are going to move into our next segment to discuss a case where we have our 15-year-old Jaden, and then we're going to see if we can apply some of all the things that we've learned to this case. So we have Jaden, who's a 15-year-old high school sophomore. He presented with anxiety and social withdrawal. He has no history of substance use, even though he has multiple older siblings that have used cannabis and nicotine. He spends most of his time online with video games. And his parents worry about screen time, but are relieved he's staying away from substances. Jaden seems to be disengaged, but very stable. So how do you think could Jaden be part of this abstaining trend that we've described in the survey that we're seeing?
We don't know. We have to find out more. We actually do. We have to. I think that what's apparent here is that there's no history There's perhaps no evidence that there's use, but if you actually keep up with the modern way in which kids use, they don't necessarily have to smoke, with like so that people smell it. And you did point nicotine use in at older siblings, and also marijuana use. So they could be using, perhaps other products. He could be using other products. So I would say never, even if you don't have the physical signs, if it is not showing the physical signs. But there are some signs that are a little concerning, right? Like the use, what we talk about, the use of the screen in the social isolation, like they're spending more time eating with what's going on. Is it, are there underlying, conditions, or maybe co-current conditions that we need to really pay attention to? I think that I would say maybe he's not using the substances, but definitely we need to find out more. In terms of the situation about the screens, it seems like parents are, again, I think it wasn't until many years later. I think it was after 50 years after tobacco was so popular, that the general surgeon put the label onto it, said this is not a good thing for you. I think the same thing I've seen. I think that when there's normalizing a little bit about, yes, it's better for their son and their daughters to be in on, online. At least they're not using like the older siblings, where, again, we don't know. We're starting to see the results of excessive use of gaming, or spending time in the internet and things like that. And so I don't know. I mean, it's a little bit concerning that the parents say, well, maybe, it could spend more time, because compared to obviously marijuana, for example, or even tobacco, this is maybe a better, lesser of two evils, you know. And at the same time, we're already seeing that this could not look so well, I think in the future, or even in the present, especially because of school performance, social, like I mentioned. So I would say, it's concerning. I think enough to then look into more. I mean, in terms of age, it does seem to be as part of this cohort, right? The people who are not access to early drug, in the early years of the pandemic, and they have continued to be abstinent. The best case scenario, right? I mean, we're thinking, because we know that the later this teen starts using, even later than 21, for alcohol and things like that, the better it is for brain development. So if you're thinking more positively and optimistic, yeah, this is good news. I would say find out better the responses and never assume anything. And what's up with the use in the gaming, and the use of screen.
Yeah, that's amazing. What I heard you say is never say never, right? So you could be missing some warning signs. So what are some of those early warning signs that we may be missing, where that makes us say, "Oh, this person never did this."
Yeah, it has to do with two very important things. I think, coming down to the really bare, minimum in terms of understanding, I would say their performance, right? So if they're not doing as well in school, it's like the equivalent of working, right? If you're really not, well, prepared to work, your productivity is gonna be, it's gonna be suffering. Either it's because of a medical condition or issues, or because of mental issues, or because of the substance use, or what have you. Might be social determinants, things that are stopping you from being productive. So for school, if the kids are, if they, especially if their production declines significantly, even within a year, pay attention to that. That's a warning sign. The other warning sign is socialization, right? And I hear a lot about, well, they're socializing through social media. Humans, are basically, wired to, the contact, right? And they're losing a little bit that, these generations. But if they have friends that were sort of getting even together to game, or doing things, outside the classroom, and now they're starting not to do that, I think that's a warning sign.
Yeah. I mean, it's very important for to note those warning signs and to be aware of them. Um, but even more, as we have learned from you through this episode, is to educate. And that includes educating the parents, siblings, loved ones that are around them so they are also able to notice these warning signs and we can get them that early treatment because early identification is very important for us. So we are more than excited that you came and talked to us about all of this. We are so appreciative of all the knowledge that you've given us. And if you are listening and you didn't take anything out of this episode, I'm going to share the two things I took out of this. The first thing is screen, screen, screen. If they won't tell you, they might put it on paper. So screen. The second thing I also learned here, and even more to reinforce, is always ask the why. Sometimes we could be so busy in our practices and the settings, hospitals, you have heavy case loads because we know there is a shortage of doctors and clinicians. But make sure you're taking the time to find out the why because that can make a huge difference. And lastly, the warning signs, right? If their performance are going down, the productivity is going down, please know that something may be going on and you should be screening and asking the why as part of that. So thank you so much for tuning in. But we're going to have Dr. Gomez give her this opportunity to, if there's any work that she's doing, anyone she'd like to shout out, any last words that she has for us that she would like to share. And while she's doing that, help me thank her in the comments, everywhere that you see her. Say thank you so much for coming to teach us today.
Thank you. Actually, just continue working towards understanding more yourselves. We are involved in education. We're involved in clinical care. We're actually part actually of the preparing for the fourth edition of the American Society of Addiction Medicine volume that's going to be actually addressing adolescent and youth substance use. But I think the most important thing I could say is follow your own, I guess, interest in looking more into this field, especially, as you come into the field, young, professionals or not so young professionals are now looking more into getting into the world of addiction and psychiatry. They both, kind of work hand by hand. So rather than be interested in what I'm doing, I think get more interested in what you can do to help us in this field. And again, substance use addiction start in adolescence and young adulthood, and the more we pay attention to it, the better it is for us to work on it.
Oh my God, thank you so much. We're so appreciative of you. Thank you for all your knowledge. Thank you for your time spending it with us on a Friday. So we know you're very busy. So thank you so much. And thank you all for tuning in into the Transformed Mind podcast. If this episode got you thinking about prevention, adolescent health, community services, please share it with a colleague and educator. Families, they may learn something from this as well. And we've linked the full Monitoring the Future survey in the show notes. So please make sure to take a look at the survey yourself. And don't forget to subscribe for more conversations. I'm Dr. O, and I hope this episode helps you feel more equipped, empowered, and informed. Continue to subscribe for Host RX breakdowns, expert interviews, like this beautiful one with Dr. Gomez, the Lived RX stories, and check out all the links. Make sure, because we're here to study and we're here to learn. Until next time, stay ready, stay aware, and stay grounded. Thank you.